I'm Angie Dubas, and today at the Biotone Open House, we're going to be demoing the hot cocoa stone massage. The ingredients for this protocol are 2 ounces of microbuff body polish, 2 teaspoons of 100% cocoa powder, 1.5 ounces of Cocoa Comfort Massage Balm, 2 rubber spa bowls, and your hot stones or heated golf balls. The session time for this therapy is 60 to 90 minutes with a recommended price of $120 to $150. The cost per treatment is $3.19, not including the cocoa powder. The table setup for the hot cocoa stone massage therapy is a fitted sheet, flat sheet, regular blanket, thermal blanket, plastic sheath, 2 bath towels, and a hand towel for the head. Once we have our client on the table, we'll place a bolster underneath her knees for comfort. For this treatment, I've mixed 2 ounces of microbuff body polish with 2 teaspoons of pure cocoa powder. I will exfoliate the arms, legs, back, and décolleté, covering each limb with a towel after exfoliation is complete. So we'll take our exfoliant and apply it in a smooth, even layer. Then work small circular motions from the top of the hip all the way down the leg, paying special attention to dry areas such as the knee, ankles, heel, top of the foot. And we'll take our client, bend her knee, place it flat, and exfoliate the back of the hip and thigh. Returning her leg down to the starting position, cover with the towel. Using that same technique, we'll follow the opposing leg, the arms, belly, and décolleté. After applying the exfoliant to the arms, legs, belly, and décolleté, we've gone ahead and removed from the legs using one hand towel, using one side of the hand towel for one leg and the other side of the hand towel for the other. Prior to undraping our client, we'll check the breast strap to make sure she's secured. Fold down the towel, taking our hand towel, fold it in half, placing it over the length of the arm, and then we press, removing the exfoliant, working our way down the arm, folding the towel in half one more time so that we can clean the underside of the arm. And then we'll take our hand towel from here and we'll fold it in half again, opening up the clean surface to remove the exfoliant from the belly. And then flipping it over to remove from the décolleté. The unused surface of the towel would be used for the other arm. After removing the exfoliant from the rest of the body, we have our client sit up, applying the exfoliant to the back in 3 passes using small circular motions. After application, we'll take our moist hand towel, lie it across the back, pat, pat, and then we'll go ahead and set our table by rolling our bath towel down close to our client's hips. Come back to remove the exfoliant. And then we'll apply our Cocoa Comfort Massage Balm in a thick layer. And then we'll return our client back to the table. Okay, so what I'm going to get you to do, go ahead and put your feet flat on the table. Lift your bum up for me, thank you. And then your legs. Great. Now I can go ahead and apply Cocoa Balm to the rest of her body. So now we'll apply the Cocoa Comfort Massage Balm to the entire body. And we want a nice, even layer, not too thick, not too thin, enough that as the product absorbs into the skin in the wrap, there's some remaining for us to use with our hot stones afterward. So we'll wrap each limb in the plastic sheath and recover it with the towel. Getting all around underneath the back of the arm, back of the neck. Cover her there. Making sure to get around the back of the calf and the back of the leg. And placing the hands on the breast, the belly, or at the side, depending on the client's comfort. Once our client is all wrapped in the plastic, it's time for us to put her in the wrap. We'll take the corners of our thermal blanket, pull it up tight, bringing it across the body on both sides. And then wrapping the blanket on top of that. After getting our client in the wrap, just going to stay there for 15 to 20 minutes. You could do a little shorter. You could do 10 minutes if you were in a time constraint. Little rocking, compression. You could do head massage, face massage, neck massage. You can come in and grab the sheet from the other side of the table and get a little movement in. Come up along the shoulders. Get a little stretching while in the wrap. You could come through the wrap itself and do trigger points or pressure points. You could come and do abdominal massage. After the wrap time is complete, we'll unwrap and we'll do our hot stone therapy. After unwrapping the client, I've gone ahead and removed the plastic from around her body, rolling it close in, and then tucking the thermal blanket in close to her as well. That will get us set up for the next step. Go ahead and recover her, and at this point we'll help our client sit up, and we'll go ahead and remove the plastic from her back. And then we'll roll the thermal blanket in close to her spine. And then we will accordion the fitted sheet and the blanket down, making sure that we leave this top edge available to us. And we'll go ahead and have her come and lay back down. Grabbing the plastic sheath and the thermal blanket between my thumb and my pointer finger. I will go and pull that down. She'll lift up her legs for me. We'll bring that back up, and voila. We're ready for massage. Now that we've removed the plastic from our client's body, we've gone ahead and put her into a prone position so that we can start our stone massage. Stones should be heated at about 125 degrees. If they're too hot for your hands, they're probably too hot for your client's skin. So checking the temperature carefully, asking your client, is that okay? Making sure that it's comfortable for them, and now we can start our stone massage. So to start my stone techniques, I'm going to do a nice long stroke down the erectors, pressing into the top of the sacrum, but not too hard. I don't want to smash the tissue into the bone, bringing to the outside of the hip and up the sides. Again, moderating my pressure over the ribs, and then doing circles around the scapulae. I can bring my stone in across the shoulder and up into the occipital ridge, and then alternate that movement side to side, lengthening the upper trap. Coming back down the spine, small circular movements, again working down the erectors. Into the top of the sacrum, and then push, pull. So bringing one arm back and one arm forward, letting the tissue pass between the stones. Moderating my pressure across the ribs and looping up around the shoulder, pulling the upper trap posterior, and then bringing the second stone up and creating a little bit of a squeeze in the tissue. Now right now I'm using large stones, but I could also use smaller stones, which can be a little easier to handle. They're also good to use the edge to get in to, say, the lamina groove, or to work up underneath the scapula, kind of getting into the subscapularis there. You could also do that same movement, pulling one stone into the other. And here we're pinching that tissue a little bit in teres major, teres minor. All right. Or if we wanted to have a little bit of fun, we could use golf balls instead. I'm going to make sure there's lots of Cocoa Comfort Massage Balm on the golf balls, starting at the top, and then as I roll down, allowing the golf balls to roll underneath my hands. And that's a nice sensation there. And then you can use these, they're small enough that you can come in and get a little pressure into quadratus lumborum. So those are just a few techniques that we can do on the back. We'll show you a few on the leg as well. So using the hot stones on the leg, we'll use the same techniques we used on the back. Stone in each hand, pressing up the length of the leg with a nice even pressure. Pausing for a moment at the ischial tuberosity, and then coming up through the glute and out to the greater trochanter. This one will come down, and then we'll come in at the IT band. Again, not pressing too hard. The IT band can be very sensitive. Up over the greater trochanter and back down. We can do some of these rotating movements or lifting with the stones through the calf. Coming down into the foot, following the line of the bone, and placing a little pressure at the joint at the base of each toe. And then working on either side of the heel, small circular motions. And then we can use the edge of our stone if we'd like to do some pressure point or reflex points. I've bent my client's leg, releasing the calf muscle. I'm going to take my stones, I've switched to smaller stones here. I'm going to come in at the base of the legs, press toward the midline as I glide down through the calf to the knee. And as I do that, you can notice how the calf puckers a little, and then small circular motions, lifting the tissue up off the bone. Once I reach the knee, I can press my hot stones into the tissue and start separating from the midline, moving out. I can also do movements where I start doing pushes and pulls, side to side. And just to keep it interesting, instead of using our smaller stones, we could switch back to our golf balls. These will give us a little bit more of a pinpoint pressure, which are great for trigger points and little knots that are frequently found in the calf muscles. Using the same techniques, pushing, pulling, compressing the tissue, long strokes down the back, whether using golf balls, small stones, or large stones. Make sure you moderate your pressure, not to bump across any bony prominences that may be uncomfortable for your client. Making sure the temperature of your rocks are 125 degrees or lower, depending on their comfort level. And then we can use those same techniques anywhere in the body, the front of the arms, the anterior leg, the abdomen. Right now I've placed a nice heated stone underneath her neck, which gives her a little bit of support as well. So just use those techniques and take them anywhere you'd like to go. If you're interested in more Biotone protocols, go to biotone.com, scroll to the bottom of the page, and click on the treatment protocol option where you can see all the protocols we've used across all of our Biotone open houses. Thank you so much for joining us today.